It's a pleasure to be here. As Mike said, I'm the Chief Innovation Officer at Boston Children's Hospital. And I want to start out by just welcoming everyone to the closing event of the Hackathon and say a few thank yous. First of all, thank you to the Hacking Pediatrics team that has worked so hard over the last year. Thank you also to Microsoft and Clifford for all the support for this wonderful facility. I think it's a big step up from where we were last year, though I love Boston Children's Hospital. Also, I want to thank my team for all the support and hard work that they've put in to help with this event. And I want to thank you, the participants, for coming out. This has been an amazing weekend. I think you put together some phenomenal projects, and my team is really looking forward to supporting you going forward as you think about the next steps. And I also want to thank whoever returned my earring. So we've heard today about a lot of solutions that really are digital health solutions. And so I'd like to talk to you today about digital health and innovation. So there's a debate going on right now. Is it $3 billion or is it $5 billion? This is a big debate. How much has been invested in digital health care this year alone by investors? And the answer depends on how you define digital health. But whether it's $3 billion or $5 billion, I can tell you with confidence, it's a lot of money. And digital health has really gotten the attention of a lot of people. So I want to talk to you today about digital health. I'm going to talk about what digital health is, why we need more digital health, what the future looks like for digital health care, and what are some of the impediments that we're seeing along the way, and then finally close with some advice for all you digital healthcare innovators. So let's get started. What is digital health? Well, in the old days, which actually weren't so long ago, digital health was best represented by the electronic medical record, a means by which doctors could digitally chart their patient encounters rather than putting the record down on paper. And today we really are at past the tipping point, I would say, where EMRs are really prevalent and widely seen. And today, digital health really means many more things than just the EMR. Digital health is mobile apps. It's mobile apps for patients to keep track of their health and their conditions. It's mobile apps for clinicians to check drug databases and get clinical information. And even EMRs are now being delivered via mobile apps. Digital health is also text messaging between clinicians, and you all know about Tiger Text, which we're using at Boston Children's Hospital. It's text messaging from clinicians out to patients, and I'll talk to you in a few minutes about a novel solution we built at Boston Children's Hospital to allow us to text message our patients. And one of these days it'll be text messaging for patients back to their doctors. I don't think we're quite there yet, but I think it's coming. And digital health also includes telehealth, which is the remote delivery of care, which can be done by leveraging cell phones or computers, as well as leveraging data collected asynchronously or virtually. And within telehealth, one of the really exciting areas is home monitoring. And here you see a device that can be used at home to help patients collect information and data about themselves and have it sent to their doctors. And digital health also includes video visits, which is another aspect of telehealth. There's a lot of activity in the market around video visits. American Well is one of the really big vendors in this space. And Google just last week announced that they were going to offer virtual clinical video visits for free through a pilot. I'm pretty interested in that. And at Boston Children's Hospital, we've been offering video follow-up visits for kids who have concussion, so they can follow up with their clinicians without having to come back to the hospital. And of course, digital health includes wearables, the Fitbits, the Jawbones, devices that collect biometric information from us that we wear as we move around. So we've been talking about what digital health is. Why do we need digital health? Well, I think for a couple reasons. First of all, we live digital lives today. We have cell phones, computers with us, we're using them, we're always connected. I bet everyone in this room has a device within a foot of them right now that they could be on, and I appreciate you're not being on right at this moment. We have tremendous penetration of mobile phones across the U.S. We're all connected. And we're actually getting all sorts of services and information served up to us digitally every day. We can look for directions, check the weather, check news, connect with friends, record our lives, all using digital technology. We use digital technology when we bank, when we get ready to fly, when we shop. Why shouldn't we have more digital technology in healthcare? I think we should. And when you start looking at the benefits that digital solutions can bring to healthcare, it's very exciting. There's a whole toolbox that digital health offers to healthcare with all sorts of benefits. So one of the benefits of digital healthcare is that we get rid of paper, and this is terrific. It means space savings. It means, as my 13-year-old daughter told me, saving trees in the environment. It means the opportunity to access information by multiple people without having to be in one place looking at a piece of paper, and that it can be available in many different locations. Another benefit of digital health is that when we think about mobile digital solutions, they're portable. Clinicians are busy people, they're on the move, and they'd like to access information while they're moving around. And digital solutions untethers them from an office, from a desk, and lets them move and be portable. And they're not the only ones getting untethered. Digital health offers the opportunity for patients to become untethered from the doctor's office, from the hospital, from a clinic. Digital health offers the ability to get care virtually wherever you are, at home, at school, at work. And digital health also offers the opportunity for better communication. There's the potential for real-time communication via video visits or asynchronous communication by email and text. And we can send documents and video. I think that digital health actually could be a better, richer form of communication between the patient and the clinician. In addition, once we get rid of paper and we replace it with data, we open up a whole new world, because we can analyze data digitally in ways that we could never do when it was tracked on paper. And the future of healthcare really looks very exciting as we think about the promise to the potential to analyze data, to mine data, to predict diseases and outcomes based on digital information. So healthcare is fundamentally complex and an information-intensive industry. And digital health really offers a number of benefits. Portability of data, mobility, better communication, and the potential for data mining and data analysis that's very exciting both for the provider and for the payer. And so while digital health is not a panacea, it won't solve all the ills in healthcare. It is a tremendously powerful tool for bringing down costs in the delivery of healthcare. So it's this great tool. What does the future of digital health look like? Well, I think there's a couple elements. I think we're going to start taking the wearables we have and we're going to start seeing clinically important data from the wearables being sent to the doctors. This is a picture of Google's new contact lens that they're developing to try to collect your glucose level in your eye. I think we're also going to see everyday objects helping us to stay healthy. So we'll have sensor-enabled clothing, smart clothing. And everyday objects like our plates, forks, and knives will have sensors to help us stay healthy. And I'm looking forward to when my spoon and fork tell me that I need to stop eating quite so much ice cream. And even our cars are going to be part of the digital health revolution. They will measure our blood pressure, they'll measure our weight, and communicate back to us. We're also going to see sensors in our environment, sensors which we'll start calling invisibles because we won't actually see them, but they'll be collecting data on us and helping us stay healthy. So this is an exciting future for us. Some of these things are even on the verge of being here now. but not all of them, and certainly not evenly distributed. So what is stopping this explosion in digital healthcare? Well, I think there's a number of factors. First of all, HIPAA and privacy. We have to be careful to adhere to the rules about how data is managed and keep it safe. And similarly, we have to be very concerned about security. All that data that's being collected for patients, about patients, the clinical data, we have to make sure it doesn't fall into the wrong hands. So we have to take security very seriously. Regulations are also an issue when we think about where digital healthcare might be going. The FDA is exploring the regulation of mobile apps and digital health, and so far they've been very even-handed in terms of what they've said, but if they were to come out with a really tough set of regulations, this could slow down the industry. I'm hopeful that they'll strike sort of a balance between safety and innovation as they put together the regulations for this new and emerging field. And another impediment to the future of digital health is the complexity of data. If you are trying to build a clinical solution, there's all sorts of different digital solutions you may need to connect with. This is a diagram from Boston Children's Hospital of some of our different IT systems. It's pretty overwhelming. Can you imagine trying to build something new on top of this? And in addition, we don't really have strong data standards, so that means interoperability can also be challenging. So in general, the IT complexity and data interoperability are challenges as we think about the future of digital healthcare. So now I'd like to offer some advice to all you innovators, and I think we only have a room of innovators today, on how to innovate in digital healthcare and give you some examples. And I really like this cartoon. It says, this really is an innovative approach, but I'm afraid we can't consider it. It's never been done before. So I don't want you to think that way. I want you first and foremost to think that if it can't be done, maybe it should be done, and maybe I'm the person to do it. So here is a little more advice. So first of all, if you're thinking about being an innovator in the digital health space, please start with a real healthcare problem. Don't start with a solution and look for a problem. Don't pick up your mobile phone and say, phone, I should be able to solve something in healthcare. That's not where you want to start. You want to start with real pain points. And you know what? We have a lot of them. So let me share a couple of the pain points that I've observed and some of the solutions that have been built recently at Boston Children's Hospital. So patient convenience is a really big opportunity for digital innovators. I think there's a paradigm shift that's happening now where we're starting to recognize that the patient is a consumer, and we should think about their convenience when we build new solutions. Telehealth actually is an exciting way to deliver healthcare more conveniently to patients. We have a project at Boston Children's Hospital in the area of teledermatology that really was an improvement in convenience. The way the telederm project worked is when a primary care doctor was seeing a patient who had a rash or a skin condition that he wasn't sure how to diagnose, he would take a picture of that skin condition and send that picture along with the medical record back to a dermatologist. The dermatologist at Boston Children's Hospital would get back to the primary care doctor within 24 to 48 hours with the diagnosis and with the recommended plan of care. The primary care doctor then closed the loop with the patient, gave them a call, and told them what needed to be done. This was so much more convenient for the patients. First of all, they didn't have to wait weeks to get an appointment with a dermatologist. They actually didn't have to drive to the dermatologist, wait in the waiting room, and have an in-person visit. They got all of the information to them without all of those steps. A real improvement in convenience. And I think there are more opportunities for thinking about patient convenience in the future. Another opportunity for innovation in the world of digital health is the ability to collect information outside of the doctor's visits. So Dr. Eugenia Chan and Eric Fliegler at Boston Children's Hospital had the idea to come up with a web-based platform called ISIS. And yes, they are changing the name. But they had it first. So what ISIS does for clinicians to get information on therapies that they give to their kids outside of the office visit. So the first application was for kids with ADHD, and the teachers and parents could actually provide feedback on how the therapies were working as they saw them between office visits. So another big opportunity for digital health innovators is to give patients information, give patients their information when and where they want it and when and where they need it. So one example of an innovation in this area is the My Passport solution that was built by the Fast Track Innovation and Technology, or FIT team, led by Alex Peltier, who's one of the organizers of the event, who I hope you've all gotten to know. So the My Passport solution is a mobile app for patients who've been admitted to the hospital, and it allows the patient and their families to see their lab results as they become available. You see the screenshot on the left. It also shows them who's on their care team, with pictures of everyone on their team along with their role and their name. And really a great way to help empower patients by giving the information to them that they need when they need it. Another big opportunity for digital innovation is in the area of clinician efficiency. How can we save doctors' time? How can we save nurses' time? How can we really help with this valuable resource? So DISCO, the Discharge Communication Platform, is another solution built by the FIT team, along with Dr. Vinnie Chang, Dr. Isabel Green-Hopkins, and Kelly Dunn. And the whole group came together to think about how they could communicate with patients after they've been discharged. So they came up with a text messaging platform, sends a text out to patients, and asks them a couple key questions. How are you feeling? Do you have your medications filled? Then that information comes back to the dashboard that you see on the right that allows a nurse to actually see all the information very quickly. Which patients need help, who has questions, and then she can make an outbound call and really leverage her time to talk with the patients who need help and not have to spend time with those that are doing just fine. So my first piece of advice to you was please solve real-world problems in healthcare. My second piece of advice to you is to work with a clinician. Clinicians are our subject matter experts, and healthcare is a complicated field. They understand the workflow, they understand the diseases, so please partner with a clinician and have them vet your new idea. So speaking of who to work with, besides a clinician, I want to encourage you to put together a team. Don't innovate by yourself. Bring together a diverse group of people that have different perspectives that can really enhance the thinking and expand the thinking around your new idea. And I think that's one of the great lessons from the hackathon is the power of teams. There's been some phenomenal teams, and I think you've all gotten a flavor for what it's like to work with other people, and I want to encourage you to keep doing that. So my next piece of advice for you is to focus on human factors and design. Think about how your solution is going to be used and try to create a user-friendly interface. I don't just mean graphical user interface. I mean, think about where the buttons go. Think about the workflow. Keep the user in mind and try to make it a good, easy solution for them. If you're designing a solution for clinicians, think about and learn about the workflow and figure out how to make this work well for them. If your solution's for the patient, make it intuitive. There goes my earring again. Make it intuitive for them. Try to design a solution that people can figure out how to use on their own and want to use on their own. And my next piece of advice is don't be afraid of failure. So innovation is an iterative process, and often what you try the first time doesn't work right away. And you should really see your failure as your first attempt in learning and take it as an opportunity to keep trying and keep coming back. To me, the only real failure is the failure to learn and the failure to try again. So, in summary, I talked to you today about what digital health is, why we need more digital health care, what the future of digital health care looks like, and some of the barriers that we're facing as we drive toward that vision. And I shared some advice with you to solve real-world problems, to work with a clinician, to bring together a team, to pay attention to human factors in design when creating your new innovation. And keep on trying. Failure is not fatal. And then I'd say my last piece of advice to you is to have fun when you're innovating and come back next year to next year's hackathon. So. I welcome the opportunity to talk with you after the event, and also if you want to reach me, I'm available by email or on Twitter, where I tweet frequently about digital health.